So then let me go through this other specialty hospital, an ortho office. Now, they've expanded greatly since we did this. I've been working with them for about 4 years. Since then, they've torn out walls, which I had no opportunity to take the Sawzall in and work with them on that. Was very disappointed. But they've added additional docs, but this focuses on their early years. And we came in and just assessed the practice. And the information we did have data on this one. We had some information around, okay, how long does it take to go from A to B? And now the interesting thing was that the software, Orthopad, doesn't give you any reports. You have to trick it to get the data. Because if you go to Orthopad's website, their primary reason for existence is to keep the doctor happy. And it's to take it from one system and pull it into another, right? So they've got their x-rays like that, and they've got their diagnosis in there. It has nothing to do with, maybe, you know, it'd be interesting to see how long that patient experience or that patient visit really was. They don't do any reports. The new version may. Back then they did not. So we had to trick Orthopad. And what we found out was, when I met with this team, the board of this office, I asked them, how long is your visit? Well, it's 5 minutes. Okay, now you're focused on you, doc. Think bigger. And they're like, oh, I don't know, maybe a half hour, an hour. So they were all over the map. And I said to them, well, the answer is, you don't know. So here was the flow. We mapped it out. Patient comes in. They go to the front desk. Are you a new patient or a follow-up patient? New patient, here's your paperwork. Go sit down, right? 20, 30 minutes to fill it out. Of course, what happens as a new patient? They may or may not be told, as I found out from the call center back then, you need to arrive 20 to 30 minutes earlier to fill out paperwork, right? So what they did was the MA would call the patient back. They'd go to the exam room, and then MA would come in and say, what are you here for? Well, what do you mean? You don't know why I'm here for? I've hurt my left knee playing softball. Oh, we need to get an x-ray. Okay. Then they come back to the exam room. Now, it all indicated on the EMR that the patient completed their, the x-ray and where they're at, what room they are. So some docs would look at the EMR and say, oh, my patient's ready for me. Most of them didn't. Really, one or two did, and the other ones never looked at the EMR. They just went back to the old way. So then, now the doc will come into the exam room, do the decision, am I going to do pharmacy, casting, surgery, and then we discharge them. That was the old way. And what we found was that the patients were all over the map depending on which doctor. So here's the data. I did change the names to protect the innocent. We had Dr. Kildare, Marcus Welby, Dr. Seuss, Dr. Pepper, and Dr. House. So you see these times, the average time. So if you ignore that column on the right, that average time in the middle doesn't look too bad, right? You could look at that and say, hey, we're doing pretty good. Now, look at the variation in the process. You've got some docs with minimal variation, which is on the right. 20 minutes and 19 minutes. The other ones are all over the map. So we started asking questions. You know what the major difference between the two on the bottom versus the ones on the top? Where's my ortho? What would be a major difference?
You were established. Doctor showed up on time.
Actually, no. The one in the Dr. Pepper was one of the biggest violators of wandering. How many have those docs that wander? God forbid. And he knows it. And so, anyways, but no. What it was is the other ones have a PA constantly with them. The other thing is we were going through this. We noticed that the docs told me the X-ray is the most inefficient spot in our process. I said, really? Yep. I'll walk by and I'll see them just sitting there doing nothing. I'm not paying them to just sit there and do nothing. So these guys need to be doing something. I said, all right, well, we looked at it, and the best we could get from the data, we found that when they checked into the time the x-rays were ordered, remember that was coming back to the MA pulling them back, going back to the room, chit-chatting with the MA, and then the MA going, okay, electronically, I'll order that. So that triggered the x-ray tech to come up and get the patient and bring them back. That took, on average, 22 minutes with a high standard deviation. Not bad, but a high standard deviation. Oh my gosh, look at the x-rays. 9 minutes average with a slow standard deviation. They're pretty efficient. Once they got there, They got their job done and moved on. Problem was is they were waiting. That's what, nobody was bringing them a patient. And then at the end, this is to complete the report. So the x-ray's done. Now this is all, that bottom one they didn't want to see, that's all physician time, right? And maybe a MA or somebody coming in and doing, putting a casting or maybe doing pharmacy or something like that. Here's the old way the patients came through. Check-in, lobby, exam room, x-ray, back to exam room. Now they may go to the scheduler's office, they may not. They may wait for the scheduler who they could never find because she's in somebody else's office doing scheduling. Some of the docs said, here, just take my card or take Sue's card and call her later to schedule your surgery, or you may need rehab, you can go out now. So it was all over the board, no standard work. Here was our recommendation. We level loaded the work. We pulled the work away from that front end. We made a triage center in the call center, meaning when they called in, they were able to, with training and structure, were able to determine you're going to need this type of x-ray. Because they know, left knee, I'm a new patient, I hurt my left knee. They knew, working with the docs, these are the protocol questions we ask. Now instead of coming in and going to the exam room, they go right to x-ray. And then they go to the exam room. That shaved 20, 30 minutes right off the top of the visit. So this was just the data. It was phenomenal difference of the number of patients that were in and out less than 30 minutes. That's the green one. In 3 days, we had 82 patients that were in and out less than 30 minutes. So what I changed with them is they need to look at 90-90. 90% of their patients are in and out in 90 minutes or less. They still use that today. They nail it. They're through the roof. I told them you need to change that to 60 minutes. Oh, we can't do that. No, we can't. But they could. They could be real close to that 90% in 60 minutes or less. Here's their growth. The office in the blue looked at the flow of their patient. Their other office in the red didn't do any lean, just because we wanted to start with one of the offices. Look at the volume. Over 600 new patient visits were handled in that new office with that new flow in 11 months, this difference was. They added virtually no extra staff in that time frame. They changed staff because people didn't like the change that was going on, but they didn't add really any more staff. So that's an ortho office being able to change that flow or the volume.